Nusantara Global Team. My name is Memo Lukito.
Hi, my name is Dina.
Hello, I'm Amalia.
Hello, my name is Ika Fitri.
Hi, my name is Marisa.
Hi, my name is Fitri.
Please enjoy our video.
Diabetes is a persistent health issue that impacts the body's process of converting food into energy. As blood sugar level rises, the pancreas responds by releasing insulin. There are several types of diabetes, with the two most common being type 1 diabetes and type 2 diabetes, but I will focus to explain the type 2 of diabetes. Type 2 diabetes is more common and develop when the pancreas cannot produce enough insulin to meet the body's need. People with our mid-age to older age are more likely to get this kind of diabetes. This is the symptoms of diabetes type 2. First, you have a urine not allowed over the night. The second, you have a very thirsty. And next, you have a low weight. And next, you have a very hungry. And next, you feel very tired and you have a more infection than usual.
Diabetes mellitus is one of the biggest health problems in Indonesia. And the International Diabetes Federation reports that about 537 million people will have diabetes. And the number of cases has been increasing over the past few decades. And the IDF predicts 783 million people will have diabetes by 2045, an increasing of 46%. And which countries has the highest rates of diabetes? The ADF Atlas has released data showing of top 10 countries for number of about 20 until 79 years, with diabetes in 2021 and 2025. Indonesia in the 5th position with the number of diabetes in this case reaching 19.5 million people. This means the prevalence of diabetes in Indonesia is 10.6%. Based on the projection made by the IDF, the increase in the number of DM sufferers will continue until 2045, when the number of DM sufferers in Indonesia is estimated to reach to 28.6 million people, in means increase 18%. Diabetes mellitus is the third highest causes of death in Indonesia for non-communicable disease, where heart disease is the highest causes, followed by cancer. However, diabetes mellitus is one of the non-communicable disease that is the target to be achieved in the Sustained Development Goals, namely reducing complications caused by this non-communicable disease.
How to prevent diabetes type 2? Please following the steps. First, healthy diet. Consume food high in fiber, low in sugar, and low in saturated fat. Second is physical activity. Exercise regularly at least 30 minutes a day and 5 times a week. Third is weight control. Maintain an ideal weight through a healthy diet and physical activity. Fourth is healthy monitoring. Please control your blood sugar, blood pressure, and cholesterol level. 5 is avoid smoking and alcohol. Quit smoking and limit alcohol consumption. And 6 is stress management. Use relaxation technique and ensure adequate sleep. And the last is education. Learn about diabetes and its risk factor.
Diagnosis of type 2 diabetes mellitus is done using blood tests to check blood sugar levels. Some commonly used tests include the first one, fasting blood sugar test, measures blood sugar levels after fasting for at least 8 hours. The second one, oral glucose tolerance test, measures blood sugar level 2 hours after drinking a glucose solution. And the third one, HbA1c test, measures the average blood sugar levels over the past 3 months.
Of type 2 diabetes mellitus aims to control blood sugar levels and prevent potential complications. Some common treatment approaches include the first one, lifestyle changes like healthy diet, regular physical activity, and maintaining a healthy weight. And the second one is oral medications. In some cases, oral medications such as metformin, sulfonylureas, or DPP-4 inhibitors may be prescribed to help control blood sugar levels. And the third one is insulin therapy. If blood sugar control is insufficient with oral medications, a doctor might prescribe insulin therapy to control blood sugar levels.
The JKN mobile app by BPJS Kesehatan Indonesia is a convenient tool for healthcare. It allows users to register, find facilities, check bills, schedule appointments, access health education, file complaints, and reach emergency contacts. Ideal for managing health insurance and medical resources while on the go.
Banyak Jenis Cegah dan Kenali Diabetes dan Obesitas is a chatbot created by the Indonesian Ministry of Health, Perkemhi Indonesia Endocrinology Society, and Novo Nordisk to raise awareness about diabetes and obesity. It offers information on this topic via WhatsApp, allowing users to check their body mass index and understand their diabetes risk. Simply contact the provided number to access Tanya Denis. The initiative aims to improve diabetes treatment service in Indonesia. focusing on early diagnosis and control. An awareness program is a key part of this effort. Tanya Gendis aims to provide relevant information for everyone in Fluenza, encouraging early consultation with healthcare professionals for better outcomes.
Here's a planning of action and budgeting for 3 years to improve type 2 diabetes in Indonesia using JKN mobile app and Tanya Gendis chatbot. The activities are training session, JKN mobile app and Tanya Gendis chatbot, health screenings diabetes for JKN members, awareness campaign to diabetes, feedback collection JKN app and Gendis chatbot, and workshop diabetes type 2, JKN app and Gendis chatbot. And here's the timeline for 3 years to improve type 2 diabetes in Indonesia using JKN mobile app and Tanya Gendis chatbot. Tanya Gendis and mobile JKN provide mobile health services, enhancing engagement and outcomes by offering accessible, personalized care. These platforms reach wider audiences, especially in underserved areas, reduce healthcare costs, and enable data analysis for targeted interventions. Tanya Gendis promotes diabetes awareness and prevention, while mobile JKN integrates with existing systems to improve communication and coordination. This makes them more effective than traditional methods in addressing diabetes and related health issues in Indonesia. The health belief model can enhance the program improving type 2 diabetes management in Indonesia using the JKN mobile app and Tanya Gendis chatbot by addressing key factors. First, perceived susceptibility is to highlight diabetes prevalence and risks. The second is perceived severity, is to inform about serious complications of unmanaged diabetes. Third, perceived benefits, explain benefits of the JKN app and Gendis chatbot for personalized health management. Fourth, perceived barriers, address obstacles like a lack of awareness, access, and cultural beliefs with education and resources. Fifth, calls to action, use reminders, notification, and outreach to prompt engagement. And the last is self-efficacy, empower users with knowledge and support for effective diabetes management. Program activities include training, screening, awareness campaigns, feedback collection, workshops, and community activities to promote the app and the chatbot, ultimately encouraging better diabetes management. Challenges and barriers for different populations in implementing activities. The first is training session. In older participants have challenges in issues with digital literacy, accessibility, and reluctance to adopt new technologies. The second is health screening. In rural residents, the challenges are limited access to clinics, transportation challenges, and shortage of healthcare professionals. The third is awareness campaigns. In low-income families, the challenges are limited access to internet, low literacy rates, and time constraint. The feedback collection. The young adults area has challenges in engagement issues, privacy concerns, and skepticism about feedback effectiveness. The next is follow-up workshop. In working professional, the challenges are time constraints, location difficulties, and prioritization of work responsibilities. Cross-cutting challenges. The challenges in language barriers such as cultural sensitivities, economic constraints, gender barriers, and health or mobility issues. And the last is mitigation strategies. Tailors communication, improve accessibility, flexible scheduling, incentive for participation, partnership with local organizations, and acting on feedback to demonstrate its value. The strategies aim to make activities more inclusive and effective for diverse populations. This one is the metrics for post-initial evaluation and sustainability of the programs. In short, the Tanya Gendis and mobile JKN app are crucial for improving healthcare access and outcomes in Indonesia, especially in diabetes type 2 management. With targeted strategies and local partnerships, we ensure inclusive and effective services. Continuous evaluation and technology will expand our reach and user satisfaction. Thank you for your support. Together, we can make a significant impact.